welcome to Hashimoto's Unfiltered, real talk, real solutions. The podcast where we cut through the noise and get straight to the heart of living with Hashimoto's. My name is Dr. Ray Benedetto, your host, and I'm here to share my expertise, personal insights, and from time to time, conversations with incredible guests to help you take control of your health. Together, we'll explore actionable items, debunk myths, and navigate the complexities of your thyroid health. So whether you're newly diagnosed or a seasoned warrior, this is your space for unfiltered truth and real hope. Let's dive in. What to do when my doctor won't order the right tests or they won't order any tests, right? That happens, that door swings both ways. Like, what do I do? Like, my doctor will only order a TSH and they will not order a full thyroid panel. They won't order anything new, right? They tell me what happens a lot of times, right? Like your TSH is normal. There's nothing else to do. Like you're fine, even though you have all the symptoms of a thyroid condition. Or you're on medication, your TSH is in range, we're done. There's nothing else to order. We don't need to order anything else. So what do you do? Like, what's the solution? Those of you who know me, who have been listening to these for long enough, yes, we want to identify a problem or a challenge. But the most important thing that I'm always striving for with my patients is, okay, great. What's the solution? How do we fix this? Like, what? Okay, that's the challenge. What do we do as a solution to that challenge, right? There always is, right? I think it's a quote from Attila the Hun. We will find a way or we will make one, right? So there's always, a solution that to be found. Let's not harp on the fact that our doctors aren't doing their job properly and running comprehensive panels or blood work on people to get an accurate diagnosis. Let's focus on the solution, what to do when it happens, because it happens all the time. I know because I've been doing this a very long time, and I've had hundreds of conversations over the years on someone who thinks they have Hashimoto's. They definitely have a thyroid condition they've already been diagnosed with, but they've never been checked for Hashimoto's, and their doctors are resistant to running any more testing. Let's talk today about the strategy, what to do. I'm going to give you 3 options. And I tell patients, pick whichever one you want, but there are 3 ways to do it. Okay, I'm going to give you 3 options. So not only are we going to figure out a solution to this problem, there's going to be 3 different solutions, okay, of your choosing. You pick whichever one you prefer. Number 1, honestly, is my preferred solution to this problem, right? What to do when your doctors won't run any tests or the right tests, primarily with the thyroid, right? Full thyroid panels. Number 1 is my preferred solution. There's a little more friction involved and a little more effort involved, but it is still my favorite, and I will explain why. That solution is continuing to ask your doctor until they say yes and not taking no for an answer. Now, the reason why this one takes a little more work and there's a little more friction involved is because we have to do a couple things. We have to kind of kill your doctor with kindness, sometimes stroke the ego a little bit, right, on how all-knowing and all-powerful they are, tongue-in-cheek. But at the same time, it takes a little, I don't want to say coaxing, but it takes a little, you have to make a case, right? You got to make the case you have to make the case to the doctor, which is ridiculous that that's the way it is. But you have to make your case like an attorney, for gosh sakes, to the doctor as to why they should send you for these tests. Ideally would like someone's doctor, like even if it's their primary care doctor, to send them, because personally I work with patients virtually, and obviously we want boots on the ground doctors, right? Somebody has been seeing a primary care doctor for years before they get to me. Ideally, we would like them to run these labs so they are in the loop, at least as far as the diagnosis if we find Hashimoto's. And so it's in their medical file, it's in someone's chart, right? I keep charts on my folks as well, but so their primary care, boots on the ground doctor, it's in the chart, right? So we have it documented. That's primarily the reason why. And this is a team, right? We do want the primary care doctor, even if they're a little resistant in the beginning, on the team, on your healthcare team, even if they're just cheering us on from the sidelines, right? So ideally, getting your doctor to run these tests would be the best way. I'm going to give you a little scripting, a little bit of an approach, and here's how you want to do it. If you have been diagnosed with a thyroid problem and you've never been tested for Hashimoto's, or this is the case scenario, right? Or you have not been diagnosed with a thyroid condition, but you think you have one and you'd like to get full testing done right out of the chute. This is the conversation you want to have. This is the scripting you want to use. You call the doctor's office, you go in there, you do whatever you got to do, right? Sometimes you got to go in person. Sometimes it's just for a phone call or messaging them through the portal on your app on your phone. What you want to do is you want to approach it like this. You want to say, hey, doc, listen, I know that, I've been diagnosed. I know, I have hypothyroidism. We've been down this road before. I'm taking the medications. My levels are normal. I get it. But I still don't feel well. Like I never got better. Like the symptoms that I have, even with my medication and with my numbers in range, I still don't feel better. Like I really don't. I don't feel any better at all. And I'd really like to see if there's maybe more going on, or maybe I can get to the bottom of this. And the terminology you want to use is, I was doing a little research. For some reason, doctors hate it when you Google stuff on the internet. I love it when my patients are proactive and educated, but for some reason, most doctors hate it when you go above their head, I guess. I don't know. And you Google stuff, and you actually try and learn things on your own, God forbid. You can tell them I was doing a little research. I tell them, don't tell them you were Googling stuff. You can tell them you were doing looking at the research, like that you found the research that says, the journal articles and stuff that says that most of hypothyroidism is Hashimoto's, up to 90%. You can tell them you even saw that. Don't tell them you were Googling stuff. Don't tell them you talked to me. We have an army of angry doctors out there because I'm sending patients to their office asking for full thyroid panels, but they're not doing their job. So I said, you go to the doctor and you say, again, the spiel, I get it. Like I'm hypothyroid. I know I'm taking my medication. My levels are normal. I know we've been down this road before, but I still don't feel well. I was doing a little research and I came across this autoimmune condition, Hashimoto's, which appears to be the cause of most of hypothyroidism in this country. And I don't think I've ever been checked for it. I don't think we've run the testing. I don't think any of my other doctors or previous doctors have run the testing. Can you please just send me for the tests, right? The antibody tests. You can even preempt them and say, because a lot of times they'll come back with, well, we don't really have to run it because it's not really going to change anything that we do treatment wise. Yeah, sure. They'll even tell you, yeah, you're right. Most of it's Hashimoto's. You can even preempt that before they even say that and tell them, I know if I have Hashimoto's, there's really nothing else you can do for me. I realize that, the treatment that we're doing is really all that you have to offer. And if I do have Hashimoto's, there's nothing else you're going to have to offer me. But I would like to know, for me, I want to know 100%, is this problem autoimmune? Again, understanding that there's nothing you're going to be able to add to my regimen other than what we're doing. But then maybe if I do know it and we can confirm it, that, I can do something on my own. I can make some lifestyle changes. I can make some dietary changes. I can do some things to better manage my health, knowing that I now have this autoimmune condition. That's the way you want to approach it. It's hard to say no to that rationale. And if your doctor is really a jerk, I'll give you, we have two more strategies, right? But that's my first line of defense. Sometimes my patients, I had someone yesterday, they're like, I don't even want to bother with that. Like, just give me the other, what are the other options? Like, I don't want to waste my time, like, what are the other options? So, but that's my preferred option. We do want the primary care doc on the team. We want at least in the chart that you have these diagnoses and, that kind of thing. It's not essential, but that's my first line of defense. I'm not trying to belittle other doctors. We do want them on the team, at least, even if they're just standing on the sidelines cheering us on, right? And not really participating in the game, which is fine. So that's the best option. That's my favorite option. That's option number one. I like that one. Again, sometimes that just doesn't get anywhere, or patients just don't want to do that. They're like, I don't want to bother. Like, it's a waste of my time. Okay. We have option number 2 and option number 3. Option number 2, you can order these tests yourself without a doctor's prescription on the internet. Like, there are multiple sites. I have used letsgetchecked.com, letsgetchecked.com. All one run-on word there. Letsgetchecked.com. They offer a ton. I get 0 by recommending them. I've just had patients use them in the past. They offer a ton of at-home testing for all kinds of stuff. And yes, they have at-home thyroid testing. It's like a finger stick. You prick your finger, you drop the blood on the thing, and you send it in. and they will do a full thyroid panel, including the antibodies. I believe that test is like $120. There's always like a 20% off coupon. So I think you can get it for around 90, somewhere in the 90s, like $90 range, $90 to $100. You say to heck with it. You go online, you go on letsgetchecked.com or some other website similar. You scroll through the menu of tests. You order the thyroid test one, the thyroid panel with antibodies. They'll send you the thing. You stick your finger in it. You drop the blood on the card. You mail it back in. They'll send you the results when they're ready. Easy peasy, right? It takes a little bit longer. It takes a few bucks, but you control it, right? You can do it whenever you want, especially if you're getting a lot of pushback from your doc. Number 3, which honestly is the quickest, easiest, and cheapest. Well, I mean, I guess going to your doctor and using your insurance and having them send you is the cheapest, because it might just go through insurance and you don't pay anything out of pocket. But it's not going to be the easiest, that's for sure. So number 3 is the quickest, easiest, cheapest, if we got to pay a few bucks out of pocket. And that is, I can order these tests for you. So I just did that. This patient I spoke with yesterday, she's like, I don't want option number one. Give me the 3 options. Let me pick one. It's like option number 1, forget it. Option number 2, okay, great. Option number 3 sounds a lot better. It sounds like the best one. So that's what I did. I sent her for these tests. So with my patients, I use an online, basically like an online dispensary or an online like natural pharmacy. I use FullScript. There's different ones out there. There's one called WholeScripts, I think. I've been using FullScript for a long time. I love them. My patients love them. It's a platform where I can add my patients under my dispensary. So I have like a virtual practice dispensary in there on FullScript, and I can add patients under me, like as my patient under my dispensary. And I can prescribe supplements to them if they need it. That's basically where it all started with FullScript. And that's where I started using it years ago, was to be able to dispense supplements at a discount off of retail that people can just, it's like Amazon. People can they carry every product you could think of, every brand. So I can prescribe it to someone, boom, they can order it, boom, it gets shipped right to them. So it's like the Amazon of supplements. They have it in like 2 days. It's great. But they recently, maybe about a year ago, maybe 2 years ago, something like that, they recently added labs. So now for my patients, I can order them labs, blood work, all kinds of specialty testing like food sensitivity or stool testing, comprehensive stool testing, Dutch testing. I use the Dutch test. You guys have heard me talk about that forever. So now they have all these tests in FullScript that I can recommend to a patient. They can pay for it and then just do the test at home. So what I can do is I can send someone for a full thyroid panel. This is what I did yesterday. Send someone for a full thyroid panel, all these thyroid tests, antibodies, the whole 9 yards at Quest. I like Quest Diagnostics. They're nationwide. So you can usually find a Quest within a drive of your home. If not, they have other labs, but I prefer Quest. So I can literally add someone under my dispensary, add the tests that we want run to their account. They pay for them through FullScript. They get the script. They go to Quest. They get the blood work done. And then the results come to me. And then I can review the tests with the patient. That panel, I believe, again, it was just yesterday. I should remember this, but a lot happens in a 24-hour period, was, I believe, $35. I think it was $35 for all the thyroid tests and the antibodies. I think it was 35. It wasn't much. It was less than 40. So this new patient I saw yesterday, she was like, sold, let's do it. Like $35. Come on. I'm going to spend that on lunch tomorrow, like $35. Let's do it. So she can just pay for it, print out the script, go to Quest, get the test done. Like today, I'll have the results in, 2 days, and then we'll know what we're dealing with. So that's option number 3. Let's recap. Option number 1, persuade, let's say, I don't say convince, persuade or gently plead your case to your doctor to get them to nicely send you. That would be ideal. Number 2, you can order these tests yourself with an at-home test kit. For example, I've used Let's Get Checked. There's other ones out there. They'll send you buy it. It's usually between $90 and $100. You'll send you the kit, do the finger stick, dry blood on the card, package it up, send it back. They'll send you the results. Usually takes, I don't know, a week or 2, something like that, 7 to 10 days. Or I can order them for you and we just get this thing done and skip all the middlemen. I can add you under full script. I can prescribe the tests for you. You can pay $35 and print out the script and go get it done at Quest near your house. And I'll have the results in 24, say 48 hours after done. And then we know what we're dealing with. That is how you get the right testing done if your doctors won't do it. There's 3 ways, right? A couple of them are a few bucks out of pocket. The third one is really not that much in the grand scheme of things, a few bucks to get the proper testing done, to get a proper diagnosis. So then we know exactly what we're dealing with and can then prescribe proper treatment based on what the accurate diagnosis is. It's the only way to do it, right? So there's your 3 ways. Kindly persuade your doctor to send you and don't take no for an answer. Order them yourself. I'll do it for you. Let's get this thing done. I'm all about, people get to me and I'm like, let's get this thing done, man. Let's get this figured out and let's get you better. We don't have to continue suffering. There are solutions for Hashimoto's, but first we got to identify it and we got to make sure that's what it is. And then we can get to work, right? And I get so much resistance, or patients that I speak to get so much resistance, people that I speak to from their doctors. So this is what you do if they just won't do it. They won't run the right tests, or they won't run comprehensive enough tests on the thyroid panel. Convince them nicely. Or if you don't even want to go that route or it doesn't work, order it yourself. I'll do it for you. Okay. That's it, gang. There is a solution. There are 3 solutions. You pick one. Whichever one you prefer. Let's get the right testing done. Let's get the right diagnosis. And if it's Hashimoto's, let's get it managed and let's get it figured out and let's get it treated. I want to thank you for tuning in to Hashimoto's Unfiltered, Real Talk, Real Solutions. Again, my name is Dr. Ray Benedetto, and I hope today's episode helped to give you the tools and the insights you need to take another step forward on your Hashimoto's journey. Don't forget to subscribe, leave a review, and share this episode if you think someone could benefit. You can also connect with me on Facebook at Dr. Ray Benedetto and on my website, drraybenedetto.com, for more resources and updates. Until next time, remember, you're not alone and real solutions are always within reach. Take care and be well.